Good day, good morning, good afternoon, good evening. If any of you can hear me and see me, please introduce yourselves on the chat box. You should have that option somewhere, I'm guessing, on your right-hand corner. I see that joining us, we're a small group today. I think everybody else went to the sinigang and adobo session, which I can't blame them for going to that one. But if you could find the chat box, please introduce yourselves. So I see Leah, Carlo, Che, and Abby from Pampanga. Thank you for joining us, my colleagues, our host, as well as the public diplomacy section from the Philippine Embassy in DC. Thank you for joining us, and thank you for your patience as we dealt with some technical difficulties to begin the room. My name is Christian Gloria, Associate Professor of Sociomedical Sciences at Columbia University. And along with me are my other speakers and dear students, Raisa Alexis Santos and Joanne Michelle Ocampo. As we get started, let me do a quick screen share here. And again, everybody, I invite you, if you, in a way, just to confirm that you can hear me, please use the chat box to introduce yourself. Tell us, we see your name already. Tell us where you're coming from, perhaps the time of the day where you are. I know that my colleagues in the Philippines are 12 hours away. We're here in New York City, that it's 7:30 in the morning there, while it's 7:30 in the evening here for myself, Raisa, and Joanne Michelle. Let's see. So thank you, Carlo Rivera, MPH student at UNC Chapel. Interested in global mental health, very much along the same lines as Joanne Michelle. Great, thank you for joining us. And so everybody, please take your time and use the chat box to not only introduce yourself, if you'd like to leave your email addresses so that you can keep in touch with each other even after our session is over, as a little effort to network. Please feel free to use the chat box however you'd like, as well as, of course, if you have any questions that you'd like to ask of us. The three of us will keep an eye on the chat boxes so that we can answer your questions during, in between each of our segments, or we'll wait for the very end. Okay, so give me 1 minute to present my screen. And I hope everybody is enjoying using There you go. And I hope that everybody is enjoying using AirMeet. It's also a first time for all of us. And so pardon me in advance for any kind of technical challenges that I'm going to be experiencing here. Just give me 1 second to get things ready. All right. So you all should now be seeing the full screen of our slides. So thank you again and welcome everybody. Kumusta? To the 2021 PhilPro Conference. Our presentation is titled The Conversation About the State of the Filipino Community's Mental Health. And again, with me are Raisa and Joanne Michelle Ocampo, a faculty, while they are graduate students at Columbia University's Mailman School of Public Health here in New York City, in New York State in the US. I know that we have some friends all the way in Pampanga, Philippines, as well as from North Carolina, in Washington, D.C. So thank you again for joining us. I know it's very early for some of you and late for some of us. And really, this presentation, we intend to be very informal, chikahan, a little chit-chat, a little gossip perhaps, and talking about mental health from very different perspectives. And so myself, I am a first-generation Filipino immigrant here in the U.S., and I'll share more a little bit about myself later. But I'd like to also share with you a little bit for now for Raisa Alexis Santos, also Filipino-American, born and raised here in New York City, Brooklyn specifically, if I'm correct, right, Raisa? And Joanne Michelle is a DrPH student, a doctoral public health student, who is Filipino-Norwegian, Filipino-Norwegian-American at this point, born in Norway, but now studying at Columbia University here in New York City in the United States. So thank you all for joining us. And of course, please jot down our email addresses. I'll show this again at the end of our session. So in case you don't have enough time to write it down now, you can write it down again down later, and we'll be more than happy to share the slides that we'll present today to any of you. So please feel free to email any of us, and we would be more than happy to not only share slides, but answer any questions and perhaps even look at collaborations moving forward. Okay. So for me, I'm an associate professor of Sociomedical Sciences with the Department of Sociomedical Sciences, a lot of words there, from the Mailman School of Public Health at Columbia University. I'm also a visiting professor and an adjunct professor of public health at Angeles University in the province of Pampanga in the Philippines. So Raisa, Alexis, and Santos, graduate student, a master's student of public health, also with my Department of Sociomedical Sciences from the Mailman School of Public Health at Columbia University. And Joanne Michelle F. Ocampo, who is a graduate student as well, doctor of public health student with the Department of Population and Family Health at Mailman School of Public Health, Columbia University as well. Okay, so thank you, Raisa and Joanne, for joining us. A round of applause from me. As a quick overview, and so many of you should already know this before entering and choosing a room. So thank you again for choosing us over the other choices for the breakout sessions, which are just as amazing. And I wish I had a chance to go there myself, especially for the sinigang versus adobo session, which I know I have a lot of strong opinions about. So our session today is a panel of Filipino faculty and students from Columbia University who will share presentations of our research, personal experiences, as well as engage with you, the participants, to find parallels and perspectives on the state of mental health before, during, and even after this pandemic. Hopefully the pandemic will be behind us sooner than later. I'll also give you, audience members, an opportunity at the very end to join us on stage, where you will be able to turn on your microphones and your video cameras so that you can join in on our discussion about your own experiences from where you are in your place in the world. And if you are shy and don't want to be on the stage, the chat box will also be available the whole time for you to share any feedback or questions. And so our session today will be broken down into 3 presentations. I will begin with a presentation about the research that I did, a small part of a very big research project based in Angeles, with Angeles University Foundation, based in Pampanga, which is a province in the Philippines. And I'm so excited to see that I have co-researchers in the room with me. Let me see if I can find them. That's Che, Abigail, and I think just the 2 of them for now. But I am just a very, very small contributor to a very large project. And I am really honored to be able to share their own hard work and their research onto this PhilPro conference platform. Certainly do not want to take any of the credit, because they have been largely doing a lot of the work. And my role had been just a small piece of public health research methods consultant. I worked with psychologists, psychiatrists, government agencies, universities, students and faculty and staff. So it is a large project, and I'll be sharing a little bit about the results from a Filipino framework. And then followed by Raisa, Alexis Santos, who will talk about mental health in the Filipino community, more in the scope of the US-American perspective and frame. And then Joanne Michelle F. Ocampo will take us at a much grander scale in terms of the global and historical context of mental health among our Filipino community. Okay, and then at the very end, again, we'll have plenty of time for questions and answers, as well as engage in discussions with everybody in the room. So thank you again for joining us. Oh, I skipped a slide. Excuse me. Give me 1 second here. My it's going in the wrong direction. There we are. So the good thing is, I think everybody in the room, from what I can see, has a background in mental health. So you should all be very familiar with what mental health is. I included the slide in case we have anybody in the audience who might not be familiar, because as a society, as a world, we tend to focus on physical health. And not until very recently, especially sort of as a weird positive side effect of this pandemic, is when suddenly the mental health platform had been spotlighted throughout the world. As we know, mental health has been around even before the pandemic, but certainly the pandemic has put us mental health onto the flat platform, being the third wave of crisis, first being the pandemic itself, followed by the economic crisis when people were losing their jobs, losing their income, and followed that where we are all in at this very moment, which is the mental health crisis that is being experienced all around the world because of the disruptions that the pandemic has put us all under. So as you know, I'll just skip through this and not take too much time, that there are many factors to mental health that causes it or contributes to it. The main categories are biological, life experiences, and family history. And for the three presentations that will be shared today, each one of us will touch on uniquely on one of these factors. And so just wait for us to discuss these further. So as you can see on this slide are a common list of mental health problems and disorders. And I'll be sharing with you some of the pilot findings that we saw from our research in Pampanga, Philippines, related to, for example, anxiety, depression, eating disorders, post-traumatic stress disorders. For my research, we will be looking at the prevalence in terms of the baseline data. And then Raisa and Joanne Michelle will be discussing more about the potential contributors and factors that affect or lead to the development of mental health problems, which is a very wide spectrum. So for this session today, we're gonna basically just touch on the surface of and the tip of the iceberg. And so I hope that this presentation will allow us to continue our conversations long after this. And so please do keep in touch with us. And I'll again share our email addresses at the end of this so that you can jot it down, and let's continue our conversations and look for ways to collaborate to improve Filipino mental health, not only in the Philippines, in the US, but all across the world. All right, so my presentation now will officially begin. And again, my work is with Angeles University Foundation, where I serve as a visiting professor of public health for the last couple of years now. And I will try to skip through some of these because we started a little bit late. I wanted to again remind everybody that I am born and raised in Metro Manila, Philippines. I lived there, born in 81, lived there till about 93, and until my family moved to California, to Texas, to Hawaii. And now very recently, just last month, I moved to New York City to begin my work with Columbia University School of Public Health. So you'll even see my little picture there. Being the school escort. As you all know, Filipinos love pageantry, and they really started training us at a very young age. I think I was maybe in third or fourth grade at this time. I had been away from the Philippines for 24 years, from 93 till about 2017, when I began returning to the Philippines just a handful of years ago. And this was when I was in Hawaii. And I realized that in Hawaii, most of my students, because of a very large Filipino-American population, most of my public health students were Filipino-Americans, born and raised in the US, don't have any interest, don't have any knowledge of the Filipino culture, the Filipino life, never been to the country. So it became a personal mission of mine to develop study abroad, service opportunities, cultural exchange, so that we can bring students from Hawaii, from the US, to the Philippines for research and service, as well as to also reconnect with their roots. So that was the main agenda of my visit since 2017. And normally before the pandemic, I would be in the Philippines about 3-4 times a year, totaling to about 2 to 3 months as a whole, cumulatively every single year. But unfortunately, I hadn't been back to the Philippines since March of last year, when the pandemic was officially announced by the World Health Organization. But I'm hoping to be able to go back very soon, starting early next year. So in the last few years, I've been doing a lot of travels to the Philippines to develop study abroad and exchange opportunities for faculty and students, and also to develop research opportunities that I will be sharing with you today with Angeles University Foundation. So just in a very short number of years, I've been all over the country, doing assessments to look at public health in general. What are the needs? What are the opportunities? And the wonderful and terrible thing about the Philippines is all of the public health problems are there times 1,000. So there are so many opportunities to do good work. And if any of you are interested in any area of public health, please do get in touch with me. I would love to bring folks from all over the country. I know that the primary audience of this conference are Americans. So if any of you would like to collaborate with me and my teams and go do some great work in the Philippines, please do keep in touch. In terms of mental health in the Philippines, the mental health law, which is the very first of its kind in the history of the Philippines as a nation, was just enacted and adopted in 2018. So very late in the game, but better late than never. The mental health law is a nationwide law that recognizes finally that mental health is a real thing, and that the country needs to do something to address it and promote mental health. And so as a product of this law, the government is allocating funding for research, for programming, for service, to develop healthcare services and programs in school systems, in healthcare facilities, in workplaces, out in communities. And so this opens a lot of great doors to promote mental health in the Philippines, finally, 2018 being the first one in our history. Fortunately, because there hasn't been a mental health law until very recently, there is very limited research on the mental health of Filipinos in the country. And these are mostly international data from the World Health Organization or other international agencies that highlight our mental health problems in the Philippines specifically. So as you can see there, in 2012, approximately 2,500 cases of suicide due to mental health problems in the Philippines. And it's since then increased into 2019, estimated around 3,500 Filipinos committed suicide. And we believe that that's largely underreported because many of these cases, unfortunately, are not reported and are not counted. As you can see, in the Philippines, mental health disorders rank third in the most common disabilities, affecting 1 in 5 Filipino adults. We, as a country, have the highest number of depressed individuals in all of Southeast Asia, and we belong to the 1/4 of countries in the world without any legislation to support mental health until 2018, when we finally adopted that mental health law. So we have a lot of work ahead of us. But better now than never to do this work. And so I'm really lucky to be a part of the Angeles University Foundation team. This is a university located in Angeles, in the province of Pampanga, Angeles City in the Philippines. I'll show you where that is in the map later on. So you can see me highlighted in the yellow as a small member of the team. These are the primary core team members, as you could see, coming from very diverse backgrounds, from psychology, Christian formation or theology, excuse me, guidance and counseling, education, nursing, information technology, myself in public health, medicine, psychiatry, and many more who are not included in this list here. And so the main point of this research, titled Mental Health Across Ages, Identifying Issues and Trends in Pampanga, is to simply collect baseline data because there's no mental health data yet in that province. And so this research project endeavors to go through the communities all across the province and assess how people are doing in terms of their mental health. And this is supported by not only the universities in Hawaii, in the Philippines, but also the Philippine Department of Science and Technology, the Philippine Council for Health Research and Development, as well as the Commission on Higher Education. These are some of the responsibilities of my role as a research consultant with the university and with the Philippine government. So you can see there, members of my team, not everybody, but some of the core members. And again, to remind you all, the main purpose of our research in the Philippines was to generate baseline data, just to see and shed light on what is happening in terms of the community's mental health, and be able to estimate the prevalence or the size, how many people are suffering from different kinds of mental health disorders and problems. Look at demographic factors, depending on age group, for example, preschool, school age, adolescents, adults, and elderly adults, to see who is suffering from different kinds of problems, so to help us see where our attention needs to focus in terms of healthcare and programs and services, as well as to use the data that we collect to develop mental health programs in communities, particularly in Angeles City and Pampanga. Okay, so Pampanga is right there, that little dark shaded little region, province in the whole country that is the Philippines. And I'm flying through some of these slides. I apologize. I have to be mindful of the time that I'm sharing with the speakers, but I'll be more than happy to share this with all of you again after the presentation. So I'm not going to read the paragraph there, but there I just wanted to show you where we did the research in a very small part of the country, and we just need to expand, hopefully with the help of some of the members of the audience here, to expand our work across the country so we could see how mental health is from every corner of our motherland. So we primarily use psychometric, psychological instruments like paper and online surveys to assess people's self-reported symptoms of different kinds of mental health, like depression, anxiety, social phobia, eating disorders, etc., post-traumatic stress disorder. We primarily used English instruments based in the US or in Europe. So it was actually quite a challenge to culturally adapt and linguistically translate the language to the community, where community members were multilingual. They spoke Tagalog, they spoke Kapampangan, they spoke other languages. And so that became one of the more surprising challenges that we faced. And we need to continue doing work to make sure that our instruments use language that are meaningful to people. Like I remembered when I was working with my colleagues there, how it was challenging to even translate or culturally adapt a word like depression. Like we don't necessarily have an equivalent in Tagalog or Kapampangan for the English term that is depression. And if we roughly translate it, it might sound more like feelings of a heavy heart, which obviously is not quite accurate or equivalent to how we would see clinical depression. So a lot of work forthcoming in that endeavor. So in the next set of slides, we'll be going very quickly, just sharing pictures again of us engaging with the communities, with the community health workers, with the research team to assess needs, as well as to invite community members to participate in our psychometric surveys so that we can see how they're doing in terms of many factors in mental health. Aside from the research, part of my duty too as a research consultant for the government is to do various lectures and workshops and trainings for universities and government agencies and communities across the country. So I've done a lot of great work with the research team here. As you can see, Cher's in the room right here in the corner. I know she's one of the audience members. Abby, I don't see where you are here. I think you're in one of the other photos later. So thank you for joining us. I know it's 7:30 in the morning there right now. There's Abby right there next to me in a conference for the Psychological Association of the Philippines. So thank you for joining us, Abby, and whoever else is in the room that joined late and I'm unable to see at this point. So really a work that is done by the whole village, if not larger. And I wanted to emphasize that so that I don't come across as taking any credit. I'm just a small consultant and serving as a messenger, delivering the good work of all of these people who participated in this large research project that hopefully will resume again very, very soon, as soon as we figure out creative ways of navigating research projects through this pandemic. And the next few slides, just to highlight some of our pilot findings from our research survey, some of the results. In a nutshell, let's see. For this set of slides will be for adolescents 12 to 19 years, a small sample of 216. We hope to expand that in the next rounds of research. In terms of depression symptoms, you'll see that 20% of the participants reported moderate to severe symptoms of depression, which is very alarming. When we divided it between males and females, you'll see that males, 29% and 12% reporting moderate to severe symptoms of depression. And for females, even higher for severe, moderate at 28% and severe reports at 24% of the participants. That's 1 in 4 of the participants who are female reporting severe experiences of depression, which is very alarming. In terms of anxiety, again, for the same age group, 12 to 19, 26.9% reporting moderate experiences of anxiety, 8.8% severe. So 8% of 216 again. That's a lot of people. When we divided it amongst the males and the females, somewhat similar in terms of moderate experiences, but in severe, you'll see that women, females, experience twice as much severe forms of anxiety compared to males at 4.7%. For social phobia, social anxiety, 23% moderate, 6.5% severe, 6.5% very severe out of 200 participants as representatives of that community in Pampanga. Between males and females, you could see a huge difference between males and females, with females reporting as much as twice, if not even more, in terms of moderate, severe, and very severe experiences of social phobia. So it already highlights to us that, generally speaking, there are a lot of people suffering from depression, anxiety, and phobia, and that females specifically are experiencing even more. So we need to do more research to dig more deeply and figure out why is that, what's causing it, and how can we address that preventively and as well as a treatment program. For self-harm, for borderline personality disorder, 21.8% out of the 200 participants. Between males and females, relatively the same, 20%, 22% male, female are reporting borderline personality disorder symptoms, which is very concerning. And I think this is the last for the adolescent group. For post-traumatic stress disorder, 29% are reporting what we would call provisional PTSD, meaning that they are raising flags, raising concerns, and then we need to refer them to clinical psychologists, psychiatrists, to do more assessments to clinically diagnose if they are in fact struggling with post-traumatic stress disorder, and give them the resources and the help that they need to be able to address it. 30% of our sample are reporting provisional already, which is very concerning. Now we're moving on to the adult groups. Same variables. Adults are defined as 20 years or older. A much larger sample here with 400 participants. A little bit of a different graphic to kind of show you something a little bit different visually. So to explain this briefly, anybody above 20, so each of these bar graphs represent a cluster of people among the 400 participants. So anybody above 20 from this line all the way to the right are reporting either moderate or severe forms of depressive symptoms among the adult population in that community, 20 and older. Okay, so that's a lot of people. The good news is there's a whole lot of other people doing better, okay, here on the left side. But we cannot forget that there are these people, adults as well as adolescents from the earlier slides, who are very likely suffering and struggling and not getting the help they need because there is a lack of services in mental health across the country. If it's not accessible, if it's not available, it could be unaffordable. For anxiety, so anybody above 10 and all the way to the right represent people who are saying that they are experiencing moderate to severe forms of anxiety. Okay. For social phobia, anybody from 31 and higher, or actually even 21 and higher, 21 all the way to the right, are reporting at least mild to moderate, severe, or very severe forms of social anxiety. Again, a lot of people who are perhaps struggling without any help or resources to help them address their social phobia and other mental health problems. For self-harm, thankfully, it's not showing as many people as we've seen in the previous slides, where people who are reporting a score of 5 or higher, very few here, are indicating borderline personality disorder symptoms, meaning that they could be at risk of self-harm, harming themselves. And lastly, for PTSD, post-traumatic stress disorder, anybody scoring at least 33 or higher, so somewhere here to the right, are experiencing symptoms of PTSD that could be of clinical concern. So they need help, and likely they're not getting the help because it's not yet available in their community. Okay, so the next steps. Unfortunately, these are very alarming heartbreaking results, unfortunately, results that we, myself personally, in a way expected, but not to such a high degree. But the good news about shedding light on these issues is that now we have data to support and show that the problem does exist. And now that we see the problem, the next steps would be, of course, to figure out, first of all, prepare publications so we can spread the word that this is what's going on in that province in the Philippines right now. Continue to do research, to dig more deeply, spread it across the country so we can see how everybody is doing, look at who's most affected, who needs the most help, train healthcare workers, doctors, medical professionals, allied health professionals, community health workers, government agencies. Let them know about what's going on and figure out solutions to these problems, figure out programs and services that we can offer in schools, in hospitals, in community centers, in government, and look at creative ways on how to reach our populations. And now with the restrictions of COVID, not being able to see each other in person, in schools or at work, we're going to need to rely on telehealth, perhaps, or e-health, so that we can connect with people remotely and virtually using our computers and mobile devices. So the pandemic has really created a lot of barriers for us and a huge wall. But thankfully, through technology and creative means, so we can break through the walls and be able to still reach the people, monitor how they're doing, and hopefully be able to provide healthcare virtually if we cannot do them in person. And even without the pandemic, as you all might know, the Philippines is divided by 7,400 something islands. And so expecting people to travel across islands is impractical, and we might have to really look at telehealth and e-health services to reach all of the communities across the country. So continue to do work, and I'm hoping again that I'll be able to return again to the Philippines starting early next year, so that we it's a big weight of guilt on my shoulders, and I'm sure for many others as well in healthcare in the Philippines as well as across the world, that even though everything's been on pause because of the pandemic, it doesn't make mental health go away. If anything, it makes it even worse, and we cannot just sit idly here and and just wait for the pandemic to go away, because it might take a long time. So we need to look at creative ways to being able to continue and resume, provide our services to the people who need them, even if we can't do them in person. So a lot of continued work, a lot of collaborations. And again, I invite everybody to reach out to us after our presentations when I share our email addresses, so that you can partner with us and we can team up as well as with others who may not be in this room, so we can promote mental health not only in the Philippines and the US, but of course globally, internationally. Okay. And a picture of one of my last times in the Philippines in 2019, before the pandemic, at the 6th Philippine Conference on Community Health in Manila. Most of these people in the room are medical students who are probably now medical doctors at the front lines. And then front and center there is the current Vice President of the Philippines, Lene Robredo. So it was a pleasure being able to share a room with her and hear her speak. So that's it. I know I may have gone over time. I apologize, Raisa and Joanne, Michelle. A lot of information on a very short amount of time, but again, happy to continue this conversation after this session. So please do keep in touch. Before we move on to our next presenter, Raisa Alexis Santos, I'd like to invite, if anybody has any questions or comments that you'd like to share with us now, please put them in the chat box. Or we actually would prefer if you'd like to save them till the end for our segment for questions and answers and discussion. But I'd like to give an opportunity for anybody who has pressing questions that you might want to ask now. Anybody? All right. Well, thank you very much for the time and the attention. I'll turn it over now to our next speaker, Ms. Raisa Alexis Santos. Let me read her bio here real quick. Again, she is a Master of Public Health student at Columbia University's Mailman School of Public Health in the Department of Sociomedical Sciences, and her email address is there if you want to jot it down while I read her bio. Her presentation title is Decolonizing the Diaspora, a research proposal towards understanding Filipino-American mental health. And for her bio, Raisa is pursuing a master's degree in public health at Columbia University, as I said. Excuse me. She currently interns as a reporter for Health Policy Watch, an online nonprofit independent global health platform. She has worked in the past with global brigades in underserved communities of Panama and Nicaragua. As a daughter of Filipino immigrants, she has a special interest in immigrant mental health and immigration policy. And in her spare time, she enjoys writing fiction and taking her friends out to eat Filipino food. Oh, I'm getting hungry now just thinking about that. And so let me stop the share screen here, and I'd like to again let us all welcome with some virtual applause our next presenter, Ms. Raisa Alexis Santos. So Raisa, the room is yours. Thank you.
Thanks, Christian, and also thanks for starting us off, and thank you for the introduction. I'm going to attempt to share this. Hopefully it works. So great, it works. So hello, everyone, and thank you for coming out here this morning, this afternoon, this evening, whatever time it is. And thanks to all my friends and family who ended up coming. Thanks for showing up and supporting me. As mentioned before, my presentation is called Decolonizing the Diaspora, a research proposal towards understanding Filipino-American mental health. So I'm actually, a little backstory here, I'm actually in the process of writing my research proposal, and Christian is my thesis advisor. So he's helping me through this process as I have my proposal due in coming weeks, and then I'll be writing the full thesis and hopefully maybe conducting this research in the months to come. We'll see how it goes. But to start us off, I'll just be reading a line from my op-ed. It is, albeit unpublished, but as Epifanio San Juan Jr. once said, he said that the irony is, although longing for home, Filipinos now belong to the world. So, because we belong to the world, Filipino immigrants and migrant workers now have adopted the moniker of the global Filipino. So, what does that mean to be a global Filipino? So, have this map over here. So overseas workers are viewed as the Philippines' biggest export. So when you think of exports, you usually think of oil, animals, wood, things along those lines. But in the Philippines, its people are viewed to be its biggest export, and I'm here today explaining why, the implications of this. So we're all over the world. We're in the Middle East, we're in North America, we're in Europe, we're in Australia, and we've touched every corner of the world, and we're probably even in Antarctica for all I know at the moment. So even though these numbers are from 2013, they've certainly grown in the years since. We are the fourth largest source of immigrants to the US, accounting for 4.6 of the foreign-born population, and the US is in fact the number one destination country, as you can see here, for overseas Filipinos. So normally I would really love to go on and talk about this in the global context of immigration and mental health, but I'm going to focus specifically on the US in general. So Filipino immigrants in the US, statistics. So Filipino migration to the US is not new. It has been a thing since the 1900s. So ever since the US annexation of the Philippines, and it actually has grown rapidly in the 1960s as a result of the combination of the US Immigration and Nationality Act, which struck down nationality-based restrictions, and the establishment of the Philippine government's Overseas Employment Program by the Labor Code of the Philippines in 1974. And as stated by the Migration Policy Institute, the Philippines was essentially ripe for large-scale labor migration, and it was meant to be a temporary migration, but it became permanent due to several push factors. So lack of sustained economic development, political instability, unabated population growth, and persistent unemployment and low wages. So because of that, moving on to the modern area, there's been big push for Filipinos to migrate, in fact, to the U.S. So there's 4.3 million Filipinos in the U.S. as of 2018, and the Philippines was the sixth largest country of origin for new permanent residents in the U.S. So where do Filipinos go? Top states and cities of residence. They usually go to California, Hawaii, Texas, New York, Illinois, and New Jersey. So Filipinos are highly concentrated in California, 44%, followed by Hawaii at 6%. And the next four states are Texas, New York, Illinois, New Jersey. They're home to 19% collectively. When it comes to cities, the biggest are Los Angeles, San Francisco, and New York City, which account for 32% of Filipinos in the US overall. And now, what do Filipinos do when they are in these states and cities? So 66% of Filipino immigrants are in the civilian labor workforce. Filipinos are much more likely to be employed in management, business, science, and arts occupation. Particularly, they are considered the backbone of the nursing workforce. Filipinos represent 28% of all immigrants working as registered nurses in 2018, and I'm going to be focusing in particular in New York and New Jersey areas. So 25% of Filipinos are employed in healthcare in this area. And also, they were, in a study conducted, they were found to have averaged the most overtime hours in 2008. So, why am I bringing this up and how is this relevant to Filipino-American mental health? Um, so Filipino Americans are considered overrepresented. They make up an integral part of healthcare in the US, but yet they are underrepresented in mental health research. Um, this is consider the irony of them being the caretakers, especially during COVID-19, and they are not yet being adequately cared for. So I'm going to briefly talk about the landscape of Filipino American mental health. So, as Christian said, the Philippines has the third highest rate of mental disorders in the WHO Pacific region. Um, and there are 6 million people living with depression and anxiety in the Philippines. For Filipino American adults, also again, the research is still relatively sparse, but what we do know that the outlook doesn't look very good at the moment. So Filipino American adults had higher rates of depression than the general U.S. population, um, and Filipino Americans are also acutely affected. So 45.6% of Filipino American adolescents have suicidal ideation, the highest rate among all ethnic groups, and 13.6% rate of depression for Filipino American youths, which is higher than other Asian American adolescents. And while Filipino Americans have higher levels of socioeconomic status when compared to other immigrant groups in the US and in New York City, with the Filipino median household income at $83,935 and which is greater than the 53,373 median for the entire New York City population. The mental health does not seem to reflect these advantages, leading once again for need for further research on depression among Filipino Americans. So even though there have been calls for research for Filipino Americans, we still continue to be aggregated with Asian Americans. So I say we have to disaggregate the data and again do more research. So this is actually the start of what I intend or hopefully intend to research in coming months as I write my thesis. So in focusing on the possible reasons for poor Filipino American mental health, I'm focusing on ethnic identity, colonial mentality, cultural stigma, and American versus Filipino values. So, first is ethnic identity. Ethnic identity is defined to be an integral part of a racial or ethnic minority's self concept, or essentially your characteristics, your behaviors, and your attitude. So, the current research suggests that ethnic identity is a vital coping resource that buffers the stress for racial discrimination. But during the process of assimilating or adjusting to American culture, um, ethnic identity may be threatened and become less salient over time. On the other side of that is colonial mentality. So, the colonial mentality is essentially the long seated colonial history of the Philippines influences Filipino mentalities, reflecting a preference for anything American and a rejection of anything Filipino. So, such an internalized ethnic inferiority exacerbates and worsens mental health for Filipino Americans, and it leads to the cultural disintegration of Filipino identity, or otherwise known as the Filipino identity crisis. Now, when talking about Filipino perception of mental health, there's a cultural stigma um, surrounding mental health, which influences help seeking and perceptions of mental health. This is influenced both by colonial and indigenous history. Research in the Philippines has found that several themes when it comes to mental health. So, families both deny the existence of mental health problems for individuals, and providers misunderstand symptoms, prescribing short term treatment as opposed to long term. And this manifests a sort of self stigma, which leads to shame or embarrassment, self blame, a sense of being a disgrace or being judged negatively for their mental illness for the individual. And this negative cultural stigma towards mental health has become a barrier for help seeking for Filipinos worldwide, with Filipino Americans in particular having low levels of help seeking for mental illness. And since they still hold on to these stigmatizing beliefs. And finally, we have individualism versus collectivism. So, which is essentially American versus Filipino values. So, collectivism, as the name says, is group goals and collective sharing, which is an important value in the Philippines and in other Asian cultures, versus individualism, which is self centered orientation that prioritizes autonomy and personal goals, which is important in American and Western culture. So, Filipino Americans, they may adopt a combination of both values or reject both and feel alienated, so they might not be sure whether or not they feel more Filipino, feel more American, or a combination of both. So there's a sense of alienation that emerges from coming from both worlds. So I've talked about all the reasons why Filipino Americans experience poor mental health, but why does this matter? So there are numerous reasons why this matters from multiple stakeholders. For researchers, it's to, essentially to get funded and to push again the importance of Filipino American health. And it's also for policymakers to change policy surrounding migration. So here are some reasons why this should matter. So first, foremost, at I guess the current everything that the most current event in our minds is the COVID-19 pandemic and the mental health tsunami that comes along with it. So, mental health was already bad for Filipinos, and COVID-19 has just exacerbated the risk of mental illness. So, as mentioned prior, because Filipinos are an integral part of the health workforce, they're experiencing the burden of both a simultaneous the physical stressors and the mental health crisis in the wake of the ongoing pandemic. And in addition to this, there's the cascading effects of mental health illness, which leads short term effects into long term debilitating ones. So, short term effects include loss of appetite, weight loss, fatigue. Long term effects can be further detrimental to the individual and then to society, which um, is brought to then I bring this point now to points 3 and 4, the economic burden and the multi-sectoral impact. So for the economic burden, so depression amounts to more annual sick days and higher rates of short-term disability than any other chronic disease. So in fact, in a survey or a study done, it found that depression resulted in $193 billion loss in earnings. And when you think about this in the Filipino context, consider also that remittances to the Philippines can also be impacted by the long term effect of mental illness. And finally, the multi-sectoral impact. So, not just healthcare is impacted by poor mental health, loss of income due to unemployment, expenses for social support, incarceration, and more are impacted. So, for example, children of mothers who had chronic depression were shown to be more likely to have behavior problems at school. And then, if children had behavioral problems at school and subsequently untreated depression, this could lead to further failure in school, delinquency, substance abuse, and entrance into the criminal justice system. A self perpetuating cycle of life course exposures that only worsens health outcomes and impedes economic development. So, this all seems pretty bleak right now, but what can we do about it? So, besides me writing this proposal and then actually writing my thesis and potentially getting to conduct this research in the New York City context, in general, more research is needed in Filipino-American mental health and Filipino mental health as a whole. So, in order to understand all the factors I listed before, such as colonial mentality, ethnic identity, assimilation of American values versus Filipino ones, and how cultural stigma, how these all impact Filipinos. So, the research I've mentioned before has been conducted in states California and Hawaii, which have large populations of Filipinos, but the current literature review that I'm doing right now, I haven't really seen um, much research done in the New York context. So I would like to also be, I would like to work alongside other New York researchers and hopefully um, start a wave of research in the area for Filipino Americans here. And in addition, in no particular order, we need to shift away from stigmatizing mental health in Filipino culture and become more open and accepting to talking about mental health, which is easier said than done. In addition, we need to adapt mental health resources and programs to the Filipino context. Um, but this also requires us to mobilize communities and give Filipinos a voice to lead at local, state, and national levels. So essentially, this is all working towards decolonizing the diaspora so we can reclaim our identity, bring care to the caretakers, and reframe the way we think about mental health. So that's my presentation for now. And thank you so much for listening. Maraming salamat. And if anyone has any questions, I'd be happy to take it.
Thank you so much, Raisa. Round of applause, virtual applause. If anybody has from our audience any questions that you'd like to ask now, please feel free to use the chat box. Otherwise, you're welcome to ask your questions and save it for the end of our session. Any questions or comments? Thank you again, Raisa, for such a great review of the Filipino mental health within the scope of the U.S. to complement my earlier presentation on the Philippine, more specific Philippine context. And now it's my pleasure to turn over the room and the microphone to our next speaker, Joanne Michelle F. Ocampo. If I may share my screen for 1 second here. Primarily so that people can see Joanne Michelle's contact information. Please jot it down, joannemichelle.ocampo@columbia.edu. And let me take a moment to introduce our next speaker. Joanne Michelle F. Ocampo is a DrPH, a Doctor of Public Health student at Columbia University's Mailman School of Public Health, a Filipino-American, and so glad to have her join us here in New York City. She is specifically with the Department of Population and Family Health in our School of Public Health in Columbia. Her presentation title is Reflecting on Our Mental Health, the Challenges and Opportunities, more in the global and historical context. Her bio is Joanne Michelle F. Ocampo is currently a Doctor of Public Health student at Columbia University, Mailman School of Public Health, where she is focusing on global public health and humanitarian crises, including how the COVID-19 pandemic affected low and middle income settings. She's currently a board member with the NGO Women of Color Advancing Peace and Security. Ocampo was formerly with the CDC Foundation, the Norwegian Institute of Public Health, and has worked for Georgetown University on NIH, NSF, and CDC-funded projects related to disease surveillance and HIV. Over the years, Ms. Ocampo has worked on a number of projects across Europe and the United States, with activities leading her to parts of Asia and West Africa. In 2017, Ocampo was recognized as one of the 100 most influential Filipino women in the world, a global FWN 100, by the San Francisco-based Filipino Women's Network. She holds a Bachelor's of Science in Biology from Eastern Connecticut State University, a Master of Science in Biohazardous Threats, Agents, and Emerging Infectious Diseases, and a Professional Certificate in Business Administration from Georgetown University. Ms. Ocampo is an avid painter, musician, and a business owner, a recreational diver, and has a multicultural background spanning Norway, the Philippines, and the US. So many lives you've lived, Ms. Ocampo. Having said that, again, a round of applause, a warm welcome to our last but certainly not the least speaker. Let me stop sharing here. And so I'd like to turn over the room and the screen to you. Thank you, Joanne Michelle.
Thank you so much, Christian, and everyone. Thank you so much for being here today. I'm really excited that you are. This is an important topic, and I know that we're competing with sinigang versus adobo, and I don't know if I'd be here if I had the choice. So between the food and the mental health discussions, but hopefully we can rewatch the sessions that we weren't able to be in. So what I'm going to do today is to talk a little bit about taking a couple of steps back from the great work that Christian and his colleagues have done in Pampanga, and also Raisa's thoughts about American or Filipino-American mental health, and think a little bit about some of the things that perhaps may have brought us to where we are today. So I'm going to share my screen now, and Christian, let me know if everything is working as needed.
Looks good.
Okay, great. So let me see. Sorry, it's my screen is a little blank right now, and I don't know why. So let me just restart this. Can you? There we go. Can you see my screen now?
Not yet. We can see only your camera.
That's strange. Let me try this again. I'm sorry for the technical fun parts of this.
No problem.
Hold on. Let me try to restart it. So as I fiddle with the technology here, I am half Tagalog, half Kapampangan. And I grew up in Norway, so I'm also Norwegian. And I'm currently living in New York City right now. So what I'm gonna, so I just want to start with sort of contextualizing what we've talked about today, which is mental health obviously starts at the individual level. And so all the things that affect us throughout our lives, through our experiences at work, school, at home, through different stages in our lives too, right? With, adolescence and childhood, adulthood. Also through our social interactions with colleagues and friends and family members. We have we all have our different health conditions, and these change throughout life. We have experienced certain things in our lives that might stay with us for a very long time. And so in general, we have, the notion of just thinking about what happens to us as individuals in life that affect our mental health, both good and bad, and sometimes even sort of in a neutral way. But we also got to think about what external factors affect us as a collective community. And so this is not to take away from the individual health effects that are relevant to our mental health, but this is to say that there are external pressures and stressors that affect us as a community. And that extends sort of beyond just sort of whether you're American or Filipino-American, European, Filipino, or Filipino. But we have certain stressors that affect us as a larger community at whole. I don't know if any of you have seen this photo before, but it's from January 13th, I believe, the day after Taal volcano erupted in 2020. I was actually on the volcano the day of the eruption, so I can say that I've been personally affected by some of the most common things that we experience as a part of the Filipino community, and that is natural disasters. Because of where the country is placed, as you all know, on top of major tectonic plate activities. It is a center of volcanic activity, typhoons. We experience earthquakes, droughts, and flooding. And even me, even though I was born in Norway, when I went back, the first time I went back was maybe 10 months, 11 months old. And that was when I experienced my first earthquake. So even though I didn't grow up there continuously, I still have had experienced natural disasters myself. And all that to say that this is an external factor that affects us a lot. About 10% of Filipinos, this was found by a Harvard group that works on disaster resilience and preparedness. So about 10% of the Filipino population have been affected by a natural disaster in the past 5 years, of which half of them have had their homes partially destroyed. And the majority are very concerned about disasters on a day-to-day basis. And this is an important stressor to remember that we face as a community. And whether you face it directly or you're worried about your mom, your dad, your lola, your lolo, your kids, your nephews, your nieces, this is something that affects us. I don't know if anyone has seen this note before, but it's a note that was released by the Japanese government right after the occupation, or during the occupation, right after they'd occupied the Philippines. And so I bring this up to make note of a couple of different things. Japan, in the last 150 years, Japan has occupied the Philippines. You see the English language here, and you see that the Americans, obviously, as you know, took over the Philippines after the Spanish-American War, and you also see remnants of our Spanish heritage here after they conquered the Philippines as well. And obviously, you all know we were under Spain for a very long time, about 350 years. And so full-scale national wars have happened in the Philippines and also in recent time. And to have nation to nation, and this is not even sort of conflicts, smaller conflicts that pop up continuously, or small or big. These are full-scale wars, and they have happened in recent time and affected our different generations in our collective community. And so this is a stressor that's important to consider when thinking about Filipino mental health as well, given that these types of experiences affect us personally, whether it was our grandparents or parents or friends, professors, etc., that were directly affected by any of these wars on all sides. I want to mention that. Another stressor and traumatic thing that we have to handle is, and I'm quivering a little in my speech because this is a very difficult slide for me to present on, but is colonial legacies. These photos are from an article by the Daily Mail of Filipinos at a human zoo called Dreamland on Coney Island here in New York. I think this was taken in the early 1900s. And I believe, sadly, I don't have the names of the people that were sadly put on exhibit for other Americans and Europeans to view. But I believe they came from the Great Igorot culture. So another stressor that we have to face is sort of this narrative of being a timeless primitive. And that is sort of collectively speaking. As a researcher, I've come across research articles that talk about our community as primitive and barbarians, and that was published not, a couple of generations ago. So it's not a very long time ago. And so it's very important to remember that there are misconstrued attitudes about our collective community that do affect us even now, even though some of these things have not happened for a while. There are inequalities across our 180 ethnic groups in the Philippines as well, and we need more research on that. We also need more research on the inequities among different groups. Another colonial legacy that is not unique to the Philippines, but in common with countries that were colonized by others, was that the health system where it was initially built in many cases to support external peoples. In our cases, European missionaries or the American forces, which is they were the main focus of that health system and the capacities. And so those are things to keep in mind when thinking about not just mental health, but public health in general, and what capacities we have to serve the people locally. And I know Raisa already mentioned a lot about the Filipino identity crisis, I believe, Raisa, you called it. And I think that's pretty accurate language to use. Here in the States, Filipinos are labeled a little differently depending on what type of survey you have to fill out. Are we Hispanic? Are we Asian? Are we Pacific Islander? Are we Filipino? Are we all of the above? What were we before we were Filipino? As I'm sure people know on this call, the Philippines was named after King Philip II of Spain. So we are called Filipinos after the Spanish king. But before that, what were we? There is that golden legend, which I don't know if you all are familiar with, but that is a way to describe the thinking around that there was nothing in the Philippines prior to the Hispanic time, or that the things that were there were primitive. There's also thoughts about there's little written documentation about the history pre-Spain, but clearly that ignores the depth of our very nuanced indigenous cultures in the country. And I'll get back to this here at the end of my presentation. Another stressor, of course, is one we're very familiar with, and that's poverty. And I believe sort of thinking about the data that Raisa mentioned earlier in regard to migration has to be seen in light of the poverty. About 20 million Filipinos still live under that poverty line. That's not to take away, of course, from the great poverty reduction that has been seen in the last couple of years, and I applaud those efforts, and I hope they continue. But of course, poverty reduction can be uneven depending on where the programs are and who they reach and who has access to them. And of course, poverty interacts with other events and stressors, the ones that I've talked about earlier, right? So in terms of armed conflict, war, natural disasters. And we've already talked about migration. So all that to say that while migration is clearly very important to our economy, to our experiences as a global community, there are negative health effects that can come with certain aspects of migration, including being separated from our families, and some of the racism and the discrimination we're seeing globally too. And so some examples include the racism we saw here in New York City during COVID, and also sadly in healthcare workplaces with our Filipino healthcare staff that were caretaking for the nation's COVID patients. So what I wanted to sort of highlight here is that as collectively, this is in addition to our individual health, but collectively, we carry a lot within us. And I wanted to take a moment to think about that and reflect on it and remind everyone that we should be kind to ourselves, exactly because collectively we have been through a lot. It varies to degrees. It varies through how much one wants to think about it, how much we've how safe the space has been to talk about these things. But I think in terms of thinking about mental health, whenever we think about the mental health outcomes that we find in our research, what we read about in the books, what we see in the news, we have to contextualize it or put it in, think about our experiences, our collective experiences, and to put it in sort of against that historical perspective, the biological and natural perspective in terms of where the island is, and on top of the volcanic or the ring of fire as it's called, and those things. So we have been through a lot, and so we should seek solutions, even though I will recognize that some of the solutions, even within mental health care or healthcare in general, are not necessarily tailored to us. because research has been focused primarily on European and North American research populations, meaning that a lot of the solutions or interventions that we have are not necessarily well contextualized to us or fitting to us. That doesn't mean we shouldn't seek them, but it does mean that when we seek solutions and care and interventions and sort of services and programs we can engage in, it requires more intentional learning on our part in terms of figuring out if it's right for us, if it's right for us on an individual level, if it's right for us on a collective level. And I just wanted to bring up some of the Tagalog words here in terms of kapwa, malasakit, bayanihan, in terms of thinking about and seeing really that empathy in one another, especially when thinking about our collective and also our individual health in general. So I would say, find those resources that work for you and then use them. If you find out that they don't work, try another one. There are many things that we can do. We can seek individual health care. There's social support within family, friends, other caretakers, even colleagues sometimes. Do what you can for your well-being. Engage in your spiritual and religious practices as they fit you. Find safe spaces, physical spaces, spiritual spaces. Build community where you can. Engage in recreational activities. I love singing and I love making food and I love writing and painting, and so those are great resources for me that I use. And I just wanted to end here on sort of this point about being curious about our heritage. We have a wonderful heritage, and there's a lot we can learn still and should learn about our community, culture, and language. And so in terms of our heritage, I want to sort of go back to that slide earlier about, the golden legend and what we didn't know about that thought that there wasn't a lot in the islands of sort of advanced civilization prior to the Spanish coming, which is clearly not true. Homo luzonensis, sort of a cousin, if you will, in the archaeological sense, was found not too long ago, actually, in Luzon. And that is human remains from 26,000 years ago in one of the caves in the Philippines. In terms of this notion that, we didn't have any written documentation or whatnot, I even saw these petroglyphs myself. Petroglyphs are inscriptions in volcanic rock. They're in Rizal, Philippines, which is very close to Manila. And these petroglyphs are about 5,000 years old, and they show humans, they show animals. And so seek and you shall find great things about our heritage. This Laguna copper plate has been, so it's at the National Museum of the Philippines, I believe, right now. It's from 900 AD, and researchers have translated what it says, and it talks about dates and years and governance and leadership, politics, legal matters. And so there are many things to learn about the Philippines that I think would help with our collective identity also. We have, over 100 languages and dialects in the Philippines, which clearly represents deep cultures across the island nation. And so all that to say, there are many things that we can do to sort of push those external pressures and events and the potential negative effects they may have on our mental health collectively away from us. And so there are many things we can do, and I encourage you to find what works for you. And that's what my presentation is. So thank you so much.
Thank you so much, Joanne, Michelle, and also Raisa. I feel like just in the last hour, we have gone from the Philippines across the United States, from Hawaii to New York, and even globally all the way to Norway and back in time. From the beginnings of humanity to where we are today, and all of these things, history to present, and even our future anxieties, all contribute to our mental health. On top of the pandemic, I know we only have 5 minutes, but barely scratched the surface, and we have only looked at the tip of the iceberg. I really do want to thank everybody who's in the room. I would love if our host, somewhere in the clouds, if you could enable all of our guests to be on the stage And not to put you all on the spotlight, but you will have an opportunity, our guests, to turn on your cameras, turn on your microphones. You don't have to turn on your camera if you don't want to, or you could leave your comments and questions in the chat so we could discuss. I do want to point a little bit of our attention to a couple of questions in the chat. One from Myla Banks. Thank you. Do you think the matter of availability of mental health providers where the majority of Filipinos live impact the low seeking for services? Filipinos do not seek services because they do not know anyone in the area. Absolutely. And I wrote my response there. Raisa, Joanne, or anybody in the room, would you like to chime in your thoughts on that question?
I could answer from a New York standpoint. I mentioned this in a prior class before, that being one of the only Filipino Americans in my neighborhood in Staten Island, it's very hard for me to find resources. I only recently started getting connected through social media to a lot of things that are actually in Queens. So without said social media, I don't think I'm very much well aware of Filipino-American communities in my area, or even more importantly, the mental health resources. They're not as readily available to us as they are, say, I would imagine they would probably even be more readily available to those in Queens or in more tight-knit communities.
Joanne, Michelle, any thoughts?
I think that I think it's hard to access services that aren't necessarily tailored to you.
Right.
To be honest, I think that there are many great services out there. I think, just as an example, if you think about the role of music in Filipino culture, for example, there could be, sort of services and support interventions that were based on things that would be more based on sort of things that are already part of the culture, that we haven't seen yet. And so I think that with more tailored interventions to the culture, they might become more appealing too for the people who are not already seeking those services. In addition to, of course, working on our, on stigmatizing health services, not just mental health. I think that's in general too. Another aspect I do believe in is that when you have a population that has been exposed to colonial legacies, trusting government, just sort of the notion of government, can be hard in terms of health system and outreach. And that is something that we've seen in other cultures as well that have colonial legacies. And so there are many things to work on at different levels here, not just the individual level. So I just wanted to add that as well.
Thank you, Joanne, Michelle, and thank you, Myla, for joining us. If you'd like to turn on your camera, you may. Did you want to introduce yourself and share any other comments while on the stage? You may need to turn up your phone. Sorry, Myla, did you want to share anything while you're on stage?
I am having technical issues with my internet over here. I live in the mountains, Fallbrook in North San Diego, California. So I think I'll stay in the chat. I'm sorry, but it doesn't look good.
It's okay. And thank you for joining us
you
all the way from
anyway.
San Diego, beautiful San Diego. Let's keep in touch. I see that you're an executive director of a great organization in mental health for Asian Americans and Filipinos. I'll follow up with you.
Yes, thank you. Sorry about.
It's okay. And I'm looking through the chat here real quick. I know that others may need to jump off to another session. You're more than welcome to. But if while we can, I'd like to at least respond to the questions presented. Stay over time. If you'd like, you may stay as well with us. I know with Keigo, she mentioned during Joanne Michelle's presentation that yes, these colonial legacies have left a trace in how we are perceived and treated. And she mentioned how she had very challenging time growing up in the England area here on the East Coast. Any thoughts on that, Joanne Michelle, that you'd like to add?
No, I don't need to add anything to that other than to say thank you so much for sharing your experience with us. I think And that's sort of the first step of even just recognizing that, sometimes we're treated ways that we shouldn't be treated. And that's a huge step. I know for me, growing up in Europe, sometimes I thought it was, not sometimes, most times I thought it was me when anything bad happened. And so I just thank you so much for sharing that.
Thank you for
Appreciate
sharing
that.
that, Kay, Go, and Joanne, Michelle. I completely relate, and I'm sure Raisa as well. I love the fact, Joanne, Michelle, you mentioned how the first step is acknowledging it, because as I mentioned on my response in the comments in the chat, that oftentimes we've internalized it, that we're no longer conscious of how much we suppress our own selves about our own potential. And in my 40 years of life, I feel like I've just now realized that, and how low I keep the ceiling, because I thought that that's where it is, but really it could be so much higher. A lot of questions from Leah. Thank you for that. And I know some of them are directed to Raisa. Raisa, would you like to respond to some of these questions?
Yes, I'd love to respond to some of these questions, and if Christian or JM, if you guys want to respond as well, also love your input. So, first question Leah asked is, how does the healthy immigrant paradox fit into your research? So, research that I've seen so far, especially I always love reading Masakowski's work, who actually did research in San Francisco and Honolulu. She found that the healthy immigrant paradox, which is essentially how first generation immigrants are healthier than, say, subsequent generations. She found that this held true, but there's this weird ground again between, like, how can you adapt it, how would this work in the New York City context, and also child immigrants, say the 1.5 generation, they had a little there was a weird um ground where their health is still into question because it's a very formative period. So again, I would love to see this in a New York context because there's a lot of West Coast research, but not necessarily East Coast. Why are Filipino Americans, and by extension other Asian subgroups, lumped together into Asian American research? Um, this is something I could like have a whole conversation about. There's the whole idea of the Asian monolith, that you can just like look at any Asian and be like, yes, they're just like, you don't have to say like, oh, they're Vietnamese or Japanese or Korean or Filipino, they're just Asian. And then again, the model minority myth, which again, yeah, keeps on lumping us in together. This doesn't necessarily, yeah, the model minority myth is a myth. It doesn't have like Asian Americans, different subgroups are all going through their own diverse range of health risk. And in addition, just lumping us in together doesn't acutely address the fact that or the diverse backgrounds and the unique mental health or like physical risks that we all have. So um this is unfortunate. I'm still calling for, like, we're all calling for disaggregation of data, but it remains to be seen if that we're like we'll be seeing that in future research. Hopefully we do. And finally, how has COVID-19 worsened the mental health crisis for Filipino Americans? So as mentioned prior, it's a combination of the in general Asian hate, that hate crimes that have been directed against all Asian Americans. Don't know, there was several news, there have been in particular Filipino attacks in New York City that have in addition to the unfortunate Asian American hate crimes, there have also just been, because Filipino Americans are an integral part of the health workforce. And actually, this is included in my research that up to September 2020, a third of the nurses who died from COVID-19 were Filipino. So, um, it's compounding all these impacts of just like the stresses of living in a multi-generational household, which most Filipino Americans are likely to be living in, such as myself. The racial discrimination and the hate crimes against us, and the fact that many of us are working in healthcare and being like completely directly exposed to COVID. There are so many things that are compounding, cascading, leading to poor mental health for us. So if anyone else wants to chime in on that, I be happy
Thank you,
to.
Raisa. And yeah, just to very, very quickly chime in, when I attended the American Public Health Association's meeting, it's a nationwide American public health meeting that occurred in Denver a couple of weeks ago. There's a huge section of Asian American research that were presented, and I'm very happy and excited to share with you all, if you weren't there in attendance, that there was a huge call for disaggregating data of the Asian American group into all of the subgroups, especially, of course, the Filipinos, which is one of the larger and faster growing communities, especially in Hawaii, in the East Coast, and in the West Coast. Now that I've moved from Hawaii, where they already disaggregate the Asian American data, I'm heartbroken to hear that New York State and New York City doesn't quite do that yet, but that is high on my agenda in terms of calling the need to do that. And in that third question about how has COVID-19 worsened mental health in the Filipino-American, at least in the context of Hawaii, where I spent the last 10 years before moving to New York last month, the most impacted or most affected by COVID in terms of infections were actually Filipinos, Native Hawaiians, and Micronesians. And in many ways, the Filipino community were most impacted because up to 90% of the healthcare workforce in Hawaii state are Filipinos. So we were at much great risk for exposure, and sure enough, that's what we were experiencing. I could go on as well forever, but with the fact that we're over time, I'll stop there. Anything you'd like to share, Joanne, on that question as well as others?
Well, I just would add that something that's very relevant to not just Filipino Americans, I think since there's so many of us abroad too, is how worried we are about our families at home. I think that's something that I also wanted to highlight, and that in places that don't have access to appropriate care, with specific measures that might not be fitting, and not getting food, or not having jobs, or not having homes, being exposed to health burdens, including COVID right now. I think that is also something that a lot of us are trying to manage too, in addition to managing the things that are happening where we live currently. And so just wanted to add that out there too, or add that to the discussion.
Thank you, Joanne. And thank you again, Myla, for your other comment in the chat box. You know that we're over time. I'll bring us all to a close, but I do want to leave one parting comment. Let's please not let this be the end of our conversation. Let me screen share again real quick our contact information. Please do email us. I would love to get in touch with all of you representing many organizations or institutions, either specifically in mental health or universities or government agencies. There are so many Filipinos across the world, but we're not very good at finding each other and collaborating and sharing resources. And we're quiet. We tend to like being in the background, and that's probably because of the legacy that Joanne Michelle had just shared earlier. We don't like to complain. We don't like to be in the spotlight or to have a megaphone, but it's about time that we do that. When I was in Hawaii over the last 10 years, Filipinos are the second largest ethnic group in Hawaii state, only second to white Americans. And I would always tell the community, the Filipino community, that we could literally own the whole state of Hawaii and outvote all of the groups if we would just engage civically and vote and be out there. But many of us Filipinos don't. And so we need to work together. It's a great time and an opportunity to collaborate, share resources. And again, let this not be the end. And hopefully FilProCon, I believe, is going to be continuing every 2 years and hopefully more frequently, so we can continue coming together and helping each other out, as well as connecting with other networks in your areas that are not connected to us. So thank you again for your time and attention. I wish we had more time to do this, but let's make another platform media to continue our conversations. But please do email us so you can be in our listserv, and we'll be in touch with you with any kind of activities and events happening virtually or hopefully sooner in person. So maraming salamat, everybody. Thank you again for joining us, and enjoy the rest of your conference with FilProCon. Salamat, aloha, and we'll see you next time. Bye-bye.